From the American Neurological Association, I'm Adeline Goss. This is ANA Investigates. Climate change is no longer a distant worry. It's showing up in neurological practice, including here in the U.S. From Lyme, meningitis in the Midwest to worsening migraines during heat waves, climate-linked neurological conditions are entering the differential. Our guests today are two experts on climate change and neurological health, Dr. Beth Malow, Professor of Neurology and Pediatrics at Vanderbilt University Medical Center, and Dr. Monica Diaz, Assistant Professor of Neurology at the University of North Carolina in Chapel Hill. They'll explore the clinical impact of climate change on neurology and how neurologists can adapt through patient care, advocacy, and research. Drs. Malow and Diaz were interviewed by Dr. Sara Stern-Nezer, Associate Professor of Neurology at the University of California, Irvine. Here's Sara.
I am here today with Dr. Beth Malow and Dr. Monica Diaz, and thank you both so much for being here with us. So, Beth, I'm going to start with you. You've talked a lot about how climate change can accelerate neurologic disease through extreme heat, air pollution. Can you give us some examples of how this happens and how it is happening right now?
Sure. Well, let's start with air pollution. When we think about air pollution, we oftentimes think about asthma and other lung diseases. However, we now know that stroke, dementia, and even the incidence of autism has been linked to air pollution. And the culprit is something called PM 2.5, which are tiny, really microscopic particles. You can think of it as like tiny soot particles that not only get into our lungs, but get into our brains. So they can accelerate dementia, they can accelerate stroke risks. And that's something that we can absolutely mitigate through climate change solutions. For example, if we can move more to renewables and not burn fossil fuels, we can decrease those particulates in our air. We can also try to minimize wildfires, which we know are actually a product of climate change due to dryness and other factors and heat. When it comes to heat, extreme heat can certainly make the air pollution worse. It can aerosolize the particles. And then we know that there are neurologic diseases that are made worse by heat. For example, multiple sclerosis. So that's just one example. We know sleep can also be affected by heat, and especially people who don't have access to air conditioning. We can certainly see more insomnia, which can then lead to a whole host of other neurologic conditions.
Dr. Diaz, we were talking about a lot of the chronic diseases that are affected by climate change, but obviously there's also specific changes related to vector-borne diseases as we see those vectors spread to regions they weren't previously in. I know now in Southern California, we previously didn't have many mosquitoes. That's something that's certainly been noticeable even in the last few years. And I know things like valley fever, even, other vector-borne diseases are really spreading that we're taught in medical school. This is, Ohio. This is for Central America. How are you seeing those patterns change with climate change from the kind of classic teaching that we get in medical school for step one and other examinations?
Yeah, that's a great question and a great point. I think one good example is Lyme disease. So, classically, we've always been taught that Lyme disease is a disease of the northeastern US, but we know now that Lyme disease is actually endemic to much of the Midwest and also much of the East Coast. And I think a lot of that has to do with warmer summer months, longer summers, and shorter winters, and that allows these vectors, these ticks, to be able to reproduce and come in contact with humans. I think another good example in the US is that a few summers ago, the first cases of malaria were identified in Texas and in Florida. And I think a lot of that has to do with just our summers being hotter and, like you mentioned, more mosquitoes being able to reproduce and come in contact with humans. And we're going to keep seeing these patterns of these vectors being able to more easily reproduce. And there could be a higher risk of other vector-borne diseases as well, including the ones that cause neurologic illness like Zika, dengue, West Nile virus. We know that all of these vector-borne diseases have increased in recent years. So I think, the lines are being blurred of what we've been taught in medical school and in residency are the geographic areas that are most prevalent for these diseases. And really when we encounter patients that we're considering might have a vector-borne disease, travel history, of course, can be helpful. We can't rely on it as much as we used to be able to, right, when we learned of this in medical school. We have to look up the most recent, reports from the CDC as to where these possible infections are endemic.
I know you're also involved in kind of global health electives. How can we increase the education for our US, North American trainees on how to treat some of these diseases as well? Because I know I have a good friend who practices in Kenya and would rather get care for malaria there, for example, because a lot of physicians in the US are just not comfortable with treatment. Do you foresee any need for education changes in our residency, medical school as we move forward? And what does that look like in a best case scenario from your perspective?
Yeah, I think just opening up the conversation on climate change, even from early years, like starting in medical school and throughout residency training is needed. Not just putting emphasis on those infections that we're most likely to encounter in the United States in terms of, education and medical school curriculum, but also focusing on, infections that are less likely to be encountered, but that we know there's a high risk of these infections, coming over to the US. So for example, malaria or other or Zika virus. So, I think we have to kind of expand the focus of infectious disease education and not just focus on the US based infections, but also worldwide infections as well.
Beth, you're at Vanderbilt, and I know you're in the Department of Neurology and Pediatrics. Do you have patients or their parents asking you about these questions now in the framework of air pollution or specifically related to climate change? And if so, how do you discuss these complex issues with your patients?
That is a great question. The truth of it is, unless I bring it up, people are not generally asking me about climate change and how it's impacting them. I really have to bring it up. It's kind of like the elephant in the room. It contributes to so much of what we see in the way of neurologic disease, but we don't oftentimes bring it up, and our patients don't necessarily ask about it. I hope people ask about it because when people ask about it, it can actually lead to change. I just read an article today from the Yale Center for Climate Communication about how people are starting to ask more, not necessarily neurologic patients, but people in general in the communities that we live in. And the barriers to people asking, like they don't always know enough, right, to talk to their legislator. And we can fill that gap because we're trusted messengers. Our patients trust us more so than the news or anything else that they necessarily get their information from. So I'm hopeful over the coming years that people will ask, that we will try to speak up and encourage people to realize that there are absolutely positively things we can do to make a difference in terms of the health risks of climate change.
That sounds like important but challenging work. What do you kind of foresee? And this is a question for both of you. How do you see the best case scenario for healthcare systems and educational systems to adjust to these challenges?
Yeah, I'll just say that healthcare systems themselves contribute to our overall carbon footprint, not just nationally, but internationally. Having healthcare systems see that, and many have really stood up, spoken up, made a big dent in how they're using, for example, waste and anesthesia gases and various other areas to really reduce emissions. So I would say part of it is modeling good behavior themselves. And then in terms of the medical education, There are a lot of opportunities to integrate climate-based neurology content into the curriculum of students, of residents, and fellows, and also to see if many medical students have actually taken a role in talking with their healthcare systems about sustainability. And that's, I think, a great thing to see our young people doing in terms of advocacy at their own medical centers.
To your point, I think the carbon footprint for hospitals is something like 5%, depending on what estimate you look at worldwide. And I think people sometimes like to poke fun at the incoming generations, but I had to say this generation cares so much, and I have so much admiration for them. So yeah, I do think they're really a good force for change. Dr. Diaz, any thoughts on your end of the healthcare system and how he adapted? I know you already spoke a little about how the medical education system can adapt as well.
Yeah, I think from the infection prevention perspective, I mean, we really have to improve surveillance of these new emerging and reemerging infections, right? Because I think improving surveillance really helps inform where efforts should be allocated to developing new vaccines or, developing new research programs on how climate change can impact infectious diseases and neurologic infectious diseases. So I think from that side, really improving surveillance is key.
That's really helpful. I think also as we're talking about surveillance and a lot of the resources that are either national or international, it sometimes can feel as though a lot of this process is out of our individual hands, which I think in talking to patients and colleagues can make people feel a little disempowered. So, what can we as individual neurologists do to help mitigate this problem without kind of getting overwhelmed by the scope of the issue?
Yeah, I mean, I can jump in. One of the things that we do when we give our presentations is we recognize how important it is not to burn out our colleagues and to say, what is an area that you're specifically interested in? Because there's several different levels. There's certainly patient education, encouraging people to tell their stories, talk to their friends, relatives, and all. There's the medical education piece. There's the health system leadership piece, reducing the carbon footprint at our centers. And then there's even getting involved in advocacy, working with, for example, at our state or federal level, working with our medical societies. So a lot of it is, what are you already doing? Are you already advocating for something else? Like I advocate for sleep research, so it's an easy stretch for me to talk to my state and federal officials about climate change. Do you love medical education? Do you love working with your health system? So, really trying to integrate it in with something they're already doing, and then giving them the tools like the Medical Society Consortium on Climate and Health is a great resource. And then there's also neurologists interested in climate and health that we've started. We are happy to share those resources.
That would be wonderful. I think the other component for advocacy is also research. So as we look at our graduating residents this June, who are newly minted neurologists going out into academic careers, what do you think are potentially areas of research in this area that really need more person power and more young neurologists to show interest in?
So I'll go ahead. So there's, like if you were to do a PubMed search on climate change effect on neurologic illness, I think you'll find very few publications. There's a need in general to study how increase in global temperatures is really affecting the epidemiology of neurologic illness. So I think there's a need, in all subspecialties to study this.
Yeah, I think that there's two areas that I see. One is certainly all the methodology around climate change. For example, standardizing how we measure, for example, the increases in the particulates or extreme heat so that we have consistency. And that's actually something that some of the international climate change groups that I'm participating in are working on as well. And then I think the second thing that's particularly important right now in our political climate in the US is to really understand how do we communicate in a way that our colleagues in neurology are comfortable talking about climate change to their patients and other groups like legislators. And how do we encourage our patients, like, for example, through storytelling? Because I think the research is important. I think we sometimes neglect that we have to do research on how we can actually make an impact as neurologists in this particular area. And that's where I feel like the climate change communication, science communication, communication about health is so critical.
What are things you recommend in those conversations when you do have them?
I'm a big advocate of storytelling and of people being able to talk to their friends, their neighbors, their relatives. It could be at a cookout or a family gathering, but really being able, when somebody says to us, gee, it's really been a hot summer, how many times do we actually respond with something related to the climate changing? Not much, right? I mean, I've been guilty of that too. I feel like if we can educate our patients in a way that they can then share, hey, Uncle George, it's been a really hot summer and I'm telling you it's taking a toll on me. I can't sleep as well as I normally do, or I've had a stroke and this could be putting me at risk for a further stroke, all the particulates and air pollution. I think that that's when we're going to start getting people to be able to be activated and talk to their legislators and get some legislative movement on this issue.
Well, I think on that positive note, I will stop there. This is such an important and nuanced topic, and I really think you both bring a delightful and illuminating perspective to the topic. So thank you again so much for your time and for your participation.
Absolutely. Thank you for having us.
Yes, thank you for the invitation.
That was Dr. Beth Malow of Vanderbilt University Medical Center and Dr. Monica Diaz of the University of North Carolina in Chapel Hill, interviewed by Dr. Sara Stern-Nezer of the University of California, Irvine. ANA Investigates is the official podcast of the American Neurological Association. The show's producers are members of the ANA Education Innovation Committee, chaired by Michelle Johansson. I'm Adeline Goss, podcast host and executive producer. Our production team this month included Sara Stern-Nezer and Jen Hurley. You can listen to past episodes of the show, subscribe to us so you never miss an episode, and access all of the ANA's educational programs on the Education tab at myana.org. That's it for ANA Investigates. See you next month.